The pain is indescribable. I think the only person who can understand the horrible amount of pain that I was in is a person who is also suffering with the same disease, because we look normal on the outside. When I was as sick as I was in March of 2007, I looked the same as I do right now.
I knew what I was feeling, and it was very, very real to me, and it was frightening because nobody knew what it was.
I had symptoms ranging from sharp shooting pains to fatigue that is hard to comprehend unless you've had that level of fatigue.
A throbbing migraine would wake me up in the night, paralyzing chills, drenching night sweats.
I would get to the bottom of my driveway and not know whether to turn right or left.
3 strokes, several months of brain seizures. I lost my ability to speak.
Loss of appetite, muscle and joint pain.
I remember laying on the couch and it felt like someone was taking a knife and just ripping me right in my heart.
I went from chilling, being hot, being cold, shaking, couldn't stop.
And I would have these uncontrollable muscle twitches all throughout my body. And I would just lay there at night in bed like a marionette, with my limbs and my body just jerking and twitching.
Since it was first reported in the United States back in 1975, Lyme disease has become one of the fastest growing infectious diseases in North America, mostly concentrated in the Northeast and western Wisconsin. The syndrome was not recognized until a cluster of cases were identified in 3 towns in southeastern Connecticut, including the towns of Lyme and Old Lyme, which gave the disease its popular name. In 2007, the Center for Disease Control and Prevention Lyme statistics showed 34.7 cases for every 100,000 persons in the top 10 states where Lyme is most common.
Lyme disease has been described as a complex infectious disease where there are multiple bacteria, often called co-infections.
The real question is, how do you get this disease? The mainline thinking today is that this is passed by the bite of a tick. I don't believe that it's limited to the bite of a tick, because many people that have Lyme disease have not been bitten by ticks, or don't even live in areas where that might be a problem. So I believe that any biting insect that deals with blood is capable of passing this disease to human beings.
Once infected, patients can have immediate skin rashes, symptoms of flu, headache, nausea, vomiting, chills, fever, joint aches.
It centers around Borrelia and involves co-infections like Babesia, Bartonella, or Ehrlichia.
Often, it may take weeks for the disease to really manifest. And then it becomes more of a chronic fatigue and neurological disorder where there's brain fog, head pressure, headaches, insomnia, anxiety.
But it seems that these symptoms don't remain constant. They move around throughout the body. There may be a pain in the bladder area for a number of months, and then that goes away, and there might be a pain somewhere else. Maybe there'd be a change in the heart rhythm. Maybe the problem will focus itself in the liver. So we're trying to catch up with these things constantly. We're monitoring the patient and seeing what is the dominant focus as we look at that patient every time they come in here. And what I mean by dominant focus, what effect is this Lyme disease having on this patient? What primary area is being involved?
As the toxicity goes up in the body, then we have reduced levels of oxygen, and we have dehydration. We start losing our minerals. And this condition is great for pathogens to come in. They got a beautiful home now, and then they'll proliferate. And in turn, they'll produce more toxins. So then you'll see more and more symptoms.
The conventional method of testing and diagnosing is often very inadequate. When you look at the routine blood tests such as the CBC, the white blood cell count will be normal. Often these spirochete infections and some of the related bacteria, they are intracellular. They are inside of the cells of the body, so the immune cells can't see them. and therefore there's no antibody response. So the typical laboratory test, for example, a Lyme disease antibody panel, will not reveal the infection.
Even the traditional doctors would say, well, it sounds like Lyme's, but my testing wasn't coming back.
And I had every test done on me in the world. They checked my liver, my kidneys, my heart. They said, we can't find anything wrong with you.
I saw probably 5 different neurologists, which I think each one played off of the other one's history of diagnosis.
I was tested for MS. They told me I was in the process of forming lupus.
The next thing was diverticulitis. Then they said, oh, something's wrong with your gallbladder that's causing this pain to radiate up in your spine. So they took the gallbladder out, and the pain, of course, continued.
And then I was told I was menopausal, which is the great catch-all for all women of a certain age. And then I was told that I was just plain stressed out.
I was with my internist, and the last time I was with her, and she kind of looked at me as if maybe I was crazy and asked me if I was depressed.
And my doctor looked at me, and he said, I can remember quote for quote because it was really pretty devastating. He said, Connie, you're not going to like what I'm going to say, but I suggest that you see a psychiatrist because there's nothing else wrong with you, and you need to get used to this pain.
The patient doesn't feel like they've been heard, or the physician really believes that they're sick. In effect, the physician is saying to the patient, this might be all in your head, and prescribes an antidepressant and sends the patient on their way.
People would think that you were crazy. You know, they think it's in your mind, and it's not something you make up, because I have a very high tolerance for pain. One, for being a police officer, but two, being in the military. I mean, I've been in situations, I know what pain feels like. This is a different form of pain.
When the symptoms become unbearable, Lyme sufferers are often forced to travel long distances for a correct diagnosis and proper professional treatment. Many of them come here, to the Covenant Health Clinic in metropolitan Atlanta, Georgia. Over the past decade, Dr. Rhett Bergeron and his staff have accepted patients with a variety of complex chronic illnesses, including cancer, diabetes, autism, and chronic fatigue syndrome, using an integrated approach to diagnosis and healing. Covenant's Lyme patients come from across the United States and even Europe to find a solution. Many have endured for up to 10 years without hope of recovery and are at last experiencing relief from the pain. Some of them had heard of the clinic from a family member or a friend who also had Lyme. For others, it was a simple click away on the internet.
One of the byproducts of this hateful disease was that I had horrific insomnia. And so I would be up 23 out of 24 hours a day. And I started researching on the web, looking for answers. And one of the things I noticed in my original investigation was that all you ever see when it comes to Lyme websites is Lyme sufferer, Lyme sufferer, Lyme sufferer. Every now and again, you would see a glimpse or a glimmer of somebody who was getting some recovery, and all roads led to Dr. Bergeron.
I can describe